Morning, everybody. Thank you very much for the introduction, Mary. I know some of you may be expecting to see Veronica Lambert here this morning. She sends her apologies. She's not able to make it due to family circumstances. So I'm Dr. Lucy Whiston. I am Research Fellow in DCU and I'm Programme Manager of the PPI Ignite Network at DCU. A lot of things in there to throw at you there, but I'll explain them as we carry on this morning. So what we're focusing on here at the moment is a very brief introduction to public and patient involvement in research. That's obviously quite a mouthful. So as a lot of you will be aware, it's typically referred to as PPI. So if you see PPI written on the slide, or if I say PPI, it's public and patient involvement in research. So just to give us a very brief introduction to that, what is PPI? What is this idea of involving the public and patients in our research? It's defined as research being conducted with or by patients or members of the public rather than to, for, or about them. What does that actually mean? Well, when we think about research, going right through, and Mary touched on this, and I was delighted that Mary touched on this, going right through from when we're starting research, when you're thinking about, well, what question are we going to look at, what is the topic we're looking at, right through to deciding the methods that are going to be used, actually conducting the research and then disseminating the findings, that patients, members of the public, people who might be impacted by the research should be taking part in all of the decisions that are made along the way. And there's two key really pertinent things to think about within that definition. The first is, who is it that we're involving? The name calls out patients and members of the public. The exact term you use might depend on the area that you're focusing on, the group that you're working at, the topic, the healthcare service you're within. Once you're involving the people that your research might potentially impact, that's what you're looking for. The other key thing is, what are you going to have your patients and members of the public contributors? What are they going to be doing? There can be some confusion that arises between involvement and engagement or participation. So engagement is key. This is where you tell people about what your research you're doing and what you have found in your research. Very important, but doesn't fall under involvement because there's no active involvement in the decision-making process. And the other key area that we can have confusion with is participation. Again, this is key. We wouldn't have any research without participation. So this is people that are taking part in focus groups, interviews, filling out questionnaires, giving samples. Absolutely key. But again, there's no involvement there in the decision-making process. So what we're looking for is involvement. It can be helpful to think about what that might look like in reality. So what I have here are some examples of what that might look like working through the research process. So starting up on the top on the left here, and working our way around. So one idea is it could be having patients or members of the public involved in working with funders to decide, well, what research is going to get funded. It could be choosing what is the research question, what is the topic of research. It could be looking at, well, how is that research going to be conducted? What methods are most appropriate for the questions that we're asking, including in the patient and public perspective within that. Looking at any documents that are prepared. So that could be information sheets. It could be your interview schedule, so the questions you're going to ask in an interview. It could be a questionnaire that you're developing or an intervention, depending on what your research is. So involving patients and members of public in the decision-making process surrounding that. Depending on how your project is organised, it could be involvement in the project steering group or your research team or your advisory committee, whatever your governance structure looks like. It could be actually helping with the actual data collection. So depending on your methods, it could be helping with things like interviewing research participants or helping to run focus groups. Taking it right through then to looking at data analysis. So what is it that you're finding from your research? And if you're developing a coding frame, looking at the themes that are coming up from interviews or focus groups, involving patients and members of the public in that process. And then right through to your dissemination. So when you're going back out to tell people what you have found, involving patients and members of the public in that, a key step. Equally important, so we all have it very clear in our mind, is what doesn't fall under the area of PPI. So taking part in a focus group or an interview, filling out a questionnaire, giving a sample, absolutely key. We wouldn't have research without it, but it doesn't fall within PPI. There can be some confusion within this area in terms of language. So what I have up here is some examples of the different words that we can use for patients and members of the public. So people living with experts by experience, PPI contributors, patient organisations, all of these terms can be used, just to add to the confusion. A number of years ago, Abbott Callan, the HRCI, did a lovely piece of work on all the language that is used. And what we could see from that piece of work was that it doesn't matter, thank you. Once you are using the terms respectfully and you're having that conversation, you know what terminology everybody is comfortable with. that's okay. It doesn't matter what term you use, once you're involving people that your research is going to impact and you're doing it in a respectful way, that's okay. More recently in the UK, there was more work done on this, and it was shown that what it really comes down to is that experiential knowledge. So involving people that actually have experience in what it is that you're looking at. That's the key thing that you're thinking of. The other area is the confusion between involvement, participation and engagement. And I'm circling back to this just to highlight to you that if you start looking at literature in this area, particularly internationally, these terms tend to be used interchangeably. So for example, we're looking for involvement. So that's active involvement in any research decisions that are being made. If you think about engagement, that is where you're telling people about your research, what you're doing, what you have found. If you look at any literature that comes from Canada, they tend to say involvement. They say engagement instead of involvement. So don't get too worried about the terminology. Just when you're looking at things internationally, have clear in your mind that is that active role in the decision-making process, and be aware that sometimes the literature might say engagement or participation when really they mean involvement, just to keep us all on our toes. And why is this important? So obviously this is a huge topic that has taken off in the last number of years in Ireland and has a huge amount of support. And why is it so important? The first reason for this importance really comes from the democratic principles. So this idea that if research is going to impact or affect people, they really should have an opportunity to have a say in what that research should look like. From another perspective, if you think about a lot of research, it is tax funded. So if people are funding the research, again, they should have a say in what that should look like. So really those democratic principles, it's the right thing to do. There's moral and ethical underpinnings there. And we can see that it can improve research quality. So we see that if you bring in that patient and public experiential knowledge alongside that researcher and professional expertise, that's where you really get huge improvements for research, particularly in relation to the relevance and the quality and the credibility of research. And we see that there's a lot of research and funding body support there. So here within Ireland, we see the likes of the Health Research Board and the Irish Research Council. They're key funders of the PPI Ignite network that we have, and are really expecting to see PPI within any grant applications that are coming in. And that is something that we can see replicated then at an international level with the likes of the European collaboration. And then when we look at research publishers such as the British Medical Journal, they actually include patient reviewers and ask you to report on what PPI you have done within your work. So there's really a lot of support there for that. And we can also see that when we look at health and social care policy, again, nationally and internationally, there's that support there for PPI. Focusing a little bit more on the palliative care area, we see there was a systematic review of metasynthesis done. So essentially a very systematic review of all the existing knowledge that we already have out there, looking at the impact of involving palliative and cancer care patients in research. Important to note is that there was a small number of studies included in this. There were 3 studies that were included in this. That's okay, it's just a flag so everybody is aware. It is a small number of studies, but still very helpful to get the information from that. So what we can see is the impact of PPI here, and they looked at them from the perspective of the patient, the research, and also from the system that you're working within. And we could see there was positive impacts for the patients in terms of mental health, sense of identity, living with purpose. There was impacts on the research in terms of that co-generation of information, so research being conducted together, and the same there with the healthcare system, opportunities to improve the service. So very briefly, if you were looking to plan PPI in your work, or if you were invited to take part in a study with PPI or reviewing a study, what are you looking for? I'd love to be able to stand up here and say, here is these steps, you follow these steps, and this is your PPI, and off you go. Unfortunately, when you think about any research that we're conducting, due to the variety of stakeholders that might be involved, the topics that you're looking at, the methods that might be used, there is no one size fits all. But what there is a plethora of resources that are available there for us to use if you're looking at using PPI. One way that can be helpful is to start to think about it in terms of the research process. So I have at the top here is the research wheel developed by Campus Engage, and it takes you right from the very, very start of the research process, which Mary touched on there, from generating ideas in the middle, working out to actually disseminating and closing out the project. So sitting down and thinking, well, what can PPI look like the whole way through that research process? Is it something that makes sense for us to have? And it takes time and effort and resources. So if there's a particular step in that there actually isn't a huge benefit, maybe there's something that you might not include PPI for in that. When you think about all the different stages, what is that PPI going to look like? So how involved are people going to be? So down the bottom here, you have the levels of public involvement, and it goes from the left over to the right. So over on the left here, it's informing, so really telling people what you're doing, consulting asking for their opinions, and then the further over to the right you get, which is where you want to be, the further over to the right, the stronger your PPI, involving, collaborating and empowering. So really having that partnership and collaboration with people. So thinking at every stage of the research process, how involved are people going to be and what is that going to look like? Now this is a very busy slide. I'm more putting this up just for you to reference back to. So there are different options that you can use for what your involvement will look like at each stage in the research cycle. Oh, there we go. Okay. Regardless of what methods you're going to use for a PPI, a key thing for you to think about is the values and principles. So what I have here on the left are the ones that have been developed by Involve, a UK organisation, and very similarly ones here from the PPI Ignite network here in Ireland. So if you think about a typical research project, you have a variety of people coming from different backgrounds, different perspectives. You want to make sure that everybody's on the same page and start things off as positively as possible. That's the idea behind the values and principles. So you want to think about things like respecting people. You want to make sure that everybody that's involved in the project knows that they're going to be listened to, and that their experience and their knowledge is given equal value the whole way throughout. Key thing to think about is support. So we know that if you have PPI contributors, that it's very important that they are remunerated for their expenses, but also that they're reimbursed for their time or their expertise like anybody else on the team. And you want to think about the support in a broader range. Is there any training or additional supports that might be needed for everybody on the team, your PPI contributors, but also the other members on your team as well might need some support or training in relation to PPI. Thinking about transparency and responsiveness, I've been very upfront about how things are going to work, how decisions have been made, why they're being made, to make sure that everybody is aware, and being responsive. So it's very important that we're very flexible, that you have an opportunity for your PPI contributors to input, make changes based on that, and have that continual loop of feedback and opportunity to make change. And thinking about diversity, so who are you going to involve? You don't want to be cherry picking the same people all the time. You want to make sure that you really have a diversity of people with that experiential knowledge. And also thinking about accountability, to how you're reporting back and how people are aware what's happening. Just in the area that might be more pertinent for yourselves, there is principles specifically for palliative care research. So these have been developed by Johnson et al. And is very much based on qualitative review of palliative care research. And there's not a huge amount of difference from the ones that we have more generally. So a key one, and this comes up time and time again, is about building and maintaining relationships. So really nurturing those the whole way throughout the process, right from the very start of the research all the way through. A lot of people say that PPI really all comes down to the relationships and how they're managed, so that's really, really key. Being flexible in involvement, so having that ingrained feedback process there and being able to make changes and adapt based on that, and finding the right people. So making sure that it's people that have that experiential knowledge that are involved the whole way through the project. And so very much a whistle-stop introduction to PPI. I'm happy to take questions afterwards. I don't think there's time for questions now, but if you want to nab me if there's any questions or anything. Thank you.